Hello and welcome. The second wave of the coronavirus across India is now abating slowly but steadily as both the number of cases as well as deaths are coming down. Also continuing to fall, unfortunately, is economic output and the potential for economic growth, further hurting tens of millions, if not more, of Indians across the country. The Center for Monitoring of Indian Economy has told IndiaSpend and us in an interview quite recently that almost 97% of Indians are now poorer thanks to COVID. In this context, how can we and must we unlock the various lockdowns that are happening across the country? How do we resume economic activity, and what are the guardrails that we should have in place to do that? Remember that we have almost 220 million Indians who are partly vaccinated or fully vaccinated. Majority, of course, have got only one shot. So to understand how we could be unlocking, what are the cautionary points that we should be keeping in mind? And finally, what should we be doing in order to think ahead of a potential third wave? I'm now joined by Dr. Professor K. Srinath Reddy, President of the Public Health Foundation of India. Dr. Reddy earlier used to head the Department of Cardiology at the All India Institute of Medical Sciences and is also now an adjunct professor of epidemiology at the Harvard School of Public Health. He used to be earlier president of the World Health Heart Federation. Thank you very much for joining me, Dr. Reddy. So first question, are we really reaching the end of the second wave? Are we at the end of the second wave, or is this an early are we misinterpreting some of these early signs?
Well, from the point of view of several indicators, it does appear that the second wave is subsiding. We are seeing the case counts dropping, despite whatever may be the challenges in terms of the actual testing and interpretation. But there's a consistent directional change towards a drop in the cases. Then we are also seeing the deaths dropping. Again, despite some of the undercounting that's been there, the trend is visible. Then we are seeing also the test positivity rates dropping over a period of time. And most importantly, we are seeing that the hospital admissions are no longer so crowded with the number of people in the intensive care or a number of people waiting outside the hospital desperately pleading for admission. So all of these taken together would suggest that we are actually seeing a substantial decrease, at least in the larger cities where the wave started. Even in some of the smaller towns, I believe we are now seeing a downward trend. The villages are a little more difficult to gauge because the testing is not adequate and our data systems are not good enough to capture all the data. But even there, we are not getting as many horror stories as we were getting, for example, about 2 weeks or 3 weeks ago. But this is in a period where a good part of India is under lockdown. So it's difficult for us to say for surety that this is going to be the happy state of affairs when the lockdown is lifted. Because we saw in the first wave that after the lockdown was relaxed in June of 2020, the cases went up. They peaked around mid-September. The deaths peaked around in September, and then they started coming down. Now, we do not know how much of a rebound will happen now. Though compared to 2020, we have had many more people either exposed and at least partially immune, vaccinated, not fully, many of them, but still partially again immune. So given that situation, it is likely that the number of susceptible people will not be as large as had happened in the first wave when we opened up. But countervailing factor is that now we have variants which are much more infectious. In fact, even in January, as we were celebrating what appeared to be the great escape from the pandemic, we had the so-called Kent variant, now called the Alpha variant, coming in, and that started ramping up the cases. Then we saw the Delta variant emerge in Haryana, in Maharashtra, and then we started seeing what the challenge was in terms of that particular variant spreading across different parts of India. So we now recognize that we still have the Delta variant, which emerged in Maharashtra but is now spread all across India, is now there in many parts of the world, has been declared to be much more infectious than even the Alpha variant, and certainly much more infectious than the original virus, still on the prowl. And given that, we cannot lay firm bets that the second wave has ended. And we have to wait and see what happens when we have our unlocking process begin.
Right.
And that is where we have to keep a careful watch.
Right. Okay. So I'm going to come to the numbers in a moment, but let me ask you about locking and unlocking. So in a state like Maharashtra, for instance, we've been under lockdown now where I am. We've been under lockdown for almost 2 months. Now, in a city like Mumbai now, the number of cases have evened out to about 900 to 1,000 cases a day, but it's been at that level for a while, maybe 2 weeks and even more. So what does that suggest? And does that suggest that lockdowns only work up to a point? And what is the utility then of keeping a lockdown going for, for almost, or a long time?
No, I don't think we ought to really prolong the lockdown. We cannot get stuck in a rut at this point in time. I think the lockdown last year was required to get the systems in place to prepare ourselves, whether it was testing kits or PPEs or ventilators or whatever, getting the systems in order, getting even the multiple departments to coordinate much better, the center and the states to coordinate much better, and it helped. The lockdown this time was because suddenly we were overcome. I mean, we had actually took it for granted that there won't be a second wave. We had dismantled many of the temporary structures that we had set up even for hospital care. We had sort of let the coordination mechanisms go into slumber. And as a result, we were caught off guard when the cases went up in such a huge surge. And we were overwhelmed. In order to catch our breath, as it were, and get the systems back in place, I think we went into a lockdown. And now everybody is fairly cautious in the unlocking process. You hear the Maharashtra Chief Minister saying, not yet, let's watch out. You see, even the Delhi Chief Minister, who generally been gung-ho about opening up, saying, we'll keep a careful watch and we'll do it in stages. So it's once bitten, twice shy. So it is important for us to unlock, but do it in stages in a graduated manner so that we can recoup the territory if suddenly there is a problem.
Right, but if you were to look at the numbers, and I illustrated the Mumbai numbers, for instance, does that suggest that the lockdown is worked, or stopped working? I mean, from the point of view of the disease actually spreading or the virus spreading at
Well,
this
I
point?
think, see, during the lockdown, the virus doesn't have much opportunity to infect the very many susceptibles who may still be there in the population, because the person spread is greatly limited. Most importantly, the super spreader events are limited. So the lockdown has achieved that purpose. But the most important thing is, how do we emerge from the lockdown, keeping some of the safeguards in place while getting on progressively with resumption of our normal activities. That is where you require personal protection in terms of masking. Now it's incontrovertible that masks are protected. Therefore, if you wear a good mask the right way, then you're likely to be substantially protected, and that will happen if almost everybody universally masks outside of home. The second thing is, try and keep to ventilated areas as much as possible. It's not always possible, but even in an office, you can reduce the amount of crowds by having shifts. Even in schools, you can operate shifts. Try and keep as much free airflow as possible. If you can keep the doors and windows open, that's fine. But there are offices which may have been air conditioned where the engineering cannot be redone at short notice now. But try again, reduce the amount of time people spend in an office, and certainly reduce the crowd. So continue as much of work as possible from home, except for the absolute essential functions. Then you also make sure that unnecessary travel is restricted. And most importantly, this temptation that seems to happen from everybody, from the ordinary family which wants to celebrate a huge wedding or a birthday party, to the politicians who want to have big rallies and the religious leaders who want to have big celebrations and processions, that temptation must be curbed with an iron will. So at least for several months now, from now, we ought to make sure it's not going to happen. Because what's the point of predicting that there could be a third wave in November if we allow it to happen? So we should try and reduce the impact of the possible resurgence, even if it is a trivial resurgence of the second wave on opening up, and certainly reduce the impact of a third wave when it comes by taking some of these precautions. But do resume the economic activities. Farming can be reduced, for example, without much difficulty because farming is in open air. There is no major issue there. So we ought to be able to do several of the economic activities also with some of these precautions. And I think allowing construction activities to take place was not a bad idea because most of it is done in the open, not very much in the confined rooms.
Right. So let me come to the numbers now. As we've all seen, the numbers are coming down everywhere, but in some places, including states, the falls seem to be quite dramatic. Should we believe these numbers now? I mean, should we be now, as some of your own colleagues have been saying, be asking the counterfactual, not that why are your numbers so high, but why are your numbers so low?
Well, I think there's definitely undercounting, both for technical reasons and possibly non-technical reasons. Technical reasons are very clear. Even if you test well with the best of techniques and intentions, you'll still miss a number of cases because the RT-PCR has false negatives in about 30 to 40% of the cases. The rapid antigen test has in more cases for a variety of reasons. If you test too early in the infection or too late in the infection, you don't catch the replicating virus. Or if you don't collect the throat swab or the nasal swab properly, don't transport it properly, don't store it in the laboratory properly, again, you will not be able to get a positive test even if the virus is present. Then, of course, there are a number of people who may be asymptomatically infected and may never turn up for testing. Even some of the people with mild symptoms may not want to get tested for a variety of reasons. So we'll definitely have an undercount there. But apart from all of that, is there undercounting because of inadequate testing, numbers of testing, or falsification of testing results? We do not know. I mean, those are possibilities, but we cannot really put an estimate on that. But what I would like to say is that assuming that there has been a considerable amount of undercounting in the cases and deaths, it is the direction that matters rather than the absolute precision. As long as the noise to signal ratio is reasonably constant, you can still follow the direction. And I think the downward direction is fairly clear in each one of these indicators, but also because the indicators are all convergent. But if you ask me, is state X really telling the truth? Or is state Y better at telling the truth? Yes, I have my own guesses that there are some states which are definitely undercounting much more than others, whereas some others are being more open and truthful than others. But if you take the all India figures, I think the directionality is reasonably certain.
Right. And you're saying it's also therefore safe to assume or presume that the directionality would apply equally across, because when the wave started, it started perhaps more in Western India or states like Maharashtra and then spread eastwards and elsewhere. So would it be easing off in the same way and the same direction, or could it be? Is it different?
Well, it differs partly because the places which started late are likely to also have subsidence later than the places which started early. The places which are much more rural have much less of transport, much less of economic activity, are unlikely to be having as many cases for many more days unless there are super spreader events. If we organize super spreader events with local body elections, assembly elections, and religious festivals, even those places will become vulnerable, as we have
Right.
seen. But in general, some of the states which have been relatively economically backward and more rural will have slower transmission. And therefore, the
Right.
peaks may be slower, and then you may not see it drag on for a long time.
Right. So now we have 220 million people who are somewhat vaccinated, i.e., many of them, everyone has got at least one dose. Some portion, close under 50 million, have got two doses. Now, what can we do with this number? Is this good enough to go somewhere? Is this can this be a contributor to the opening or the unlocking equation in any way?
Well, I would say that this is inadequate at the moment, but we have to live with the fact that we have to vaccinate many more people and much faster, while maintaining our other precautions, which I already mentioned, masking and avoiding super
Right.
spreader events and so on. Because we still do not know what the threshold of protection is. We have already made big mistakes with the so-called herd immunity calculation last year and even early this year, because we depended upon the natural infection to produce that herd immunity, which was a total mistake, and as I have been repeatedly saying so. But take two examples from Brazil, which are very, very interesting. In January this year, the province of Manaus, in the place called Manaus, where 76% of the people tested positive for antibodies in a serosurveillance study. 76%. The epidemic was still raging. The hospitals were crowded. There were many deaths happening. The pandemic was out of control. So there was virtually no herd immunity at all. On the other hand, if you take the example of another province called Serrana, where they systematically went about testing the impact of vaccination versus an adjoining province, and they showed that by having 60% vaccination between February and April, they reduced the deaths due to COVID by 95% and COVID infections by 86%. And this was on the basis of immunization. So compared to the uncertain protection provided by varying doses of viral count in a natural infection, if you have good vaccination, then your protection is much better.
Right.
And therefore, if you look at Britain, which is also very interesting, again, 2 days back, just when the data from Serrana in Brazil were released, Britain declared that for the first time since March 2020, they had not a single death from COVID. And Britain has now vaccinated about 60% people, at least one dose. So we now recognize that probably around 60% is a reasonably good threshold. And that is the period when we can breathe a little more confidently and comfortably. But till that time, we ought to maintain all our precautions.
Right. So now there is talk of a third wave. A couple of questions, quick questions here. So one is that, what are the lessons that we can take away now? For instance, and let me pinpoint that. We've seen, let's say, the breakouts like the black fungus. We've also understood now for quite some time that diabetes is a core contributor, and you pointed it out yourself in my earlier interviews with you. Knowing all of this, and maybe knowing something more that is not visible to lay people like me, what else and how else can we be better prepared for the next wave, whenever that may come?
Well, I think it's very simple. Firstly, we ought to continue some of these precautions till we are sure that the third wave is coming or not coming, and what magnitude it will attain. Secondly, we ought to prepare our systems much better. Our primary care systems must be much stronger for early detection of cases. You must have healthcare teams with citizen volunteers, because our primary healthcare team is still understaffed. With the help of citizen volunteers, household surveillance of people with symptoms or people with very close contact history to be isolated on suspicion, but also be tested for verification. And that is an early catching of cases that's going to limit the spread. Then the second element, of course, those who require home care should be provided supportive home care, monitored home care with telemedicine, but the frontline health workers should also play a supportive role in that. And those who require hospitalization must be assured of emergency transport so that they don't have to really search for taxis which will charge them 20,000 rupees, but they'll be taken immediately to a hospital location where they'll be assured of hospitalization. And those hospitals must have adequate oxygen, drugs, and other supplies. So these are the things that we must ensure. And no state should be caught unprepared at this point in time after what we experienced in the second wave in saying that we will not have enough oxygen, we will not have enough
Right.
medicines, we will not have enough ventilators and so on. So I think that's going to be critical, preparing all of that. We may be over-prepared for all we know. We are like, people are saying you must prepare for intensive care units for pediatrics, lot more pediatric beds, lot more pediatric intensive care units. Maybe children will not be affected in such large numbers and not seriously. We do not know. Maybe we'll be over prepared. But we can never be over prepared in a place like India where our health system is anyway under equipped and understaffed. If not for COVID, they'll be useful for something else. Children will require hospital beds for something else. Adults will require hospital beds for something else. So investing in improving our healthcare infrastructure from primary, secondary, and tertiary care levels, making sure that hospitals have oxygen, all of these are things that we are actually going to be building into a more stable and sturdy health system. COVID or no COVID, it'll all be in good stead.
Right. And last question, medicine protocols. In India, the feeling is, particularly when you talk to doctors from other parts of the world, that the medicines that doctors prescribe in India, apart from that they are overprescribed, also don't seem to be in sync with what is being practiced elsewhere, and which in turn obviously causes its own problems, as we've seen with steroids. How do we in a more structured way respond to this or address this going forward?
Unfortunately, there is a virtual laissez-faire system that operates in most hospitals in India. Because while guidelines may be prepared by the All India Institute of Medical Sciences or by the Indian Council of Medical Research through the National Technical Task Force, they're not binding on anybody. Because each state can adopt its own strategy, each hospital can adopt its own strategy, each doctor can adopt his or her own strategy. Now, there is a certain degree of individual judgment that comes into place. But some broad standard management guidelines should be followed saying that this has evidence behind it, this has no evidence behind it. Those which are evidence-based must be used. Those where there is clear-cut evidence that they don't work, they should not be used.
Right.
Where there could be a slight gray zone in which evidence is a little uncertain but could be of potential use, then individual judgments can be exercised based on the patient's profile. But if you look at Britain, for example, there is the National Health Service, which, with the help of different experts from an institution called NICE, but even the NHS itself, comes up with standard protocols. Most people follow those standard protocols. There could be some individual exceptions, of course, depending on the patient. The treating team can make some exceptions, but those exceptions are very few. In
Right.
here, there is a system virtually which is, I call it laissez-faire, I can even call it anarchy. And therefore, the private drug companies, the private equipment companies, all of them can actually influence the medical practitioner's behavior and sell drugs at exorbitant costs. And ultimately, the honest doctor also may overprescribe because they are anxious to do something, and others may be in nexus with the pharmaceuticals. So we ought to prevent that by having very clear-cut, evidence-based guidelines which are prepared with the help of experts from all across the country, not necessarily only in Delhi. All wisdom doesn't lie in Delhi, whether in medicine or in any other field. So consult people from everywhere and then get the best of expertise and then prepare those guidelines, but keep constantly talking and openly debating. There can be differences of opinion, but they should be aired. And then we must come up with clear cut guidelines saying that, okay, this is where we have absolutely certain evidence of benefit or harm
Right.
or no use. And here there are some flexibilities where you can use it, but they should generally be applicable across the country. And as experience is being gathered in different parts of the country, that experience must constantly feed back into this process. If some doctor in Kerala or in Hyderabad or in Bhopal finds something is very useful, then that must be tried out and critically appraised. But again, just case series or individual experiences that in my experience this has happened doesn't really stand up as medical evidence. It should be subjected to scrutiny, trials, or even case series must be critically appraised. So those are the kind of things that must be institutionalized and across the country. And if we can bring in those standardization elements, then we'll find a lot of misuse and abuse
Right.
of drugs being prevented.
Right, right. Dr. Reddy, we've run out of time. Thank you so much for joining me, and do hope to speak to you soon again, and all the very best in the meanwhile. Thank you.
Thank you.